I
you know,
started going into it. I was like, oh, we were in
You
therapy
were
session
like-
for a second. I was like, whoa, wait,
you
hold
were
on,
like,
hold on.
finally someone
I have
asked.
to redirect. Welcome to another episode of the Jobology podcast. I am your host, Brandon, and today my guest is Kat. Kat is a therapist. I'm going to let her kind of explain a little more in detail what kind of therapy. But first, thank you for being with me today, Kat.
Thanks for asking me.
Appreciate it. The first way we've kind of started out now in the new format of the podcast is, if you had to describe your job in a sentence, how would you describe your job?
The first thing that comes to mind for me is holding space and helping you on your journey.
Holding space. What do you mean by holding space?
I think sometimes when people are suffering or when there's immense amount of pains, there's a need, or people feel the need to jump in and fix it right away. Or people maybe feel the need of like, if I'm in this much pain, I need to like kind of reel it in a little bit. Like, I feel like my job is, let's let it be out there. Can we sit with it? I'm not going to get scared. I'm not going to try to fix it. I can just be here with you in this moment.
What about the option of dumping my pain onto somebody else?
Well,
no, okay, never mind. Sorry. No. What would you say is the biggest misconception about therapy?
that your therapist is going to make you feel better.
Oh, wow. Okay.
Yeah.
Dang, that hits in the core a little bit right there. Okay.
Right.
Explain.
Well, so I wish I could make you feel better.
Sure.
You know, like I don't like seeing people in pain necessarily. And I also don't have the magic to take it all away. And also I feel like that would invalidate your experience.
Sure.
I might help you long-term in your journey, but for the most part, when you're seeing me in that hour, or if you're needing to see me when things are not going well, chances are like that hour, you're not going to feel 100 times better walking away. In fact, if you're doing a lot of work in therapy, you're doing a lot of heavy lifting, oftentimes you're going to leave maybe feeling tired or exhausted.
I was going to say, even
feeling
maybe worse,
sad.
if like, dang, we brought up a lot of stuff today, but it's to better you in the long term.
Yeah, and I tell my patients all the time, good work doesn't necessarily always feel good.
Interesting. Okay.
You know, like I know, even just speaking as someone who has a therapist and goes to my own personal therapy, I know sometimes I leave and I feel terrible. But that's because I've talked about things or looked at things that I typically try to avoid. And that's because they're extremely painful. And I'm getting caught up in my own stuff, or I'm having patterns continue, or things that I maybe don't like happen because I'm not addressing things that need to be addressed.
Got it. That's interesting. I was going to also ask if therapists go to therapy. Okay. I don't know. Maybe you guys have all the answers and you're like, I don't need to go to therapy. I got it all figured out.
No. Well, actually, interestingly enough, some grad programs require you to go to therapy for a set amount of hours, which I think is really important. And I've had some colleagues who haven't ever been to therapy. Yeah. And I find that interesting because I'm like, whoa, you're that well?
Yeah. You're that secure with yourself?
Yeah.
Awesome.
I'm like, that's really cool. And I'm also just kind of curious what their conception of therapy was before being the therapist and never being someone who's received it or been in that relationship. Yeah. I also think there's something to be said about if you've only been the therapist and been the authority figure, as opposed to the person where it's like you have to be aware of like what it's like to be in the seat and be the vulnerable one, as opposed to the person, you know, kind of not necessarily like the Wizard of Oz, like I'm the wizard behind the curtain. Sure. Right. But there's a different relationship, like how I am in my personal life versus how I show up professionally is very different. Got it.
Okay. I think that's fair. Like, I think that can go for a lot of jobs of like, you know, I don't know that, you know, the surgeon or the businessman is always buttoned up, you know, hey, you got to have fun too. But in the moment, that's what we're here for. That's what we're working on.
Yeah. Okay. We're here for you.
Got it. Nice. All right. I know that if I tell my attorney something, he can't say anything. I know that if somebody wants to look at my medical records, the doctor says no. Is there some level of something like that with therapy where I know that my therapist isn't going to run and tell everybody my business?
Yes. Okay. So everywhere that I've worked, we have something that's called the informed consent, and it happens during the admissions process.
Interesting.
And up front, we tell them everything is confidential unless you tell us that you're a harm to yourself or others, meaning if you tell us you feel suicidal or homicidal.
Fair enough.
If there's instances of child abuse, elder abuse, or adult dependent abuse.
Sure.
Or if you're about to do something that could hurt people.
Okay.
In which case we have to make, the appropriate reports, or we have to, call the hospital and say, hey, we need to do a hold.
Okay.
But other than that, everything else is confidential.
Does that, okay, now I'm curious. Does that happen like in the moment? So I always like to use myself as an example for anything because I don't care what everybody thinks of me, so whatever. So let's say I'm in therapy with you and I say, hey, I'm having a really rough day. I'm not sure what I'm going to do when I get home. It could be great. It could be really bad. Like I don't know where I'm at. And is there like a button under the desk that you hit that alerts the hospital? Do you call? Do you go, hey, hold on 1 second, let me step outside for a minute? Or do you wait till they leave? Like, how does that work? I don't even understand.
Yeah, that can be really hard. So I always ask people, like, what does that mean?
Sure.
Are you going to feel safe when you go home? Or being direct, hey, are you having thoughts of killing yourself? Are you feeling suicidal?
Sure.
One of my colleagues has said this best, and it's kind of stuck with me, but being direct is being kind.
Sure. And don't beat around the bush.
Yeah. And suicide is an uncomfortable topic.
Of course.
And I think sometimes people are like, do you want to hurt yourself? And it's like, well, that can have a lot of different meanings,
Absolutely.
But hey, are you feeling suicidal? Yes. Okay. Do you have plan or intent? If there's plan and intent, or if there's just intent, then I need to make sure that you get someplace safe. And that's sometimes having the direct conversation right then and there with the person, calling emergency contact, calling 911.
Dang. Okay.
Yeah. But it happens on the spot, at least from my experience.
Fair enough. That's another thing I always like to tell everybody is like, this is one person's experience. Somebody else might have a different experience. And something I also want to say in this moment is like, because we're talking about such a sensitive topic of therapy, if there is anything that's brought up that I say that you're like, just let me know and we'll move on. I have no issue with that. But if it does that happen frequently? Like, is that something like, is that an everyday thing, an every month thing, an every year thing? How often is it that you're having to call emergency services for somebody?
It depends. Okay. It truly just depends. I work at what's considered a higher level of care. So I work in partial hospitalization and I work in intensive outpatient.
Awesome.
So it just tends to be a bit more of an acute setting. I've also worked in crisis centers where 911 is getting called pretty frequently.
Yeah. Okay.
So it really just depends on the population that you're working with.
Got it. Okay. Interesting. You kind of mentioned it there a little bit. Could you go into a little more detail on exactly what kind of therapy you specialize in?
So I'm currently working at a women's trauma center.
Okay.
So I'm primarily doing trauma therapy, and then I also do a lot of work with substance use disorder, mood disorder, so major depressive disorder, bipolar disorder, generalized anxiety disorder, and on occasion maybe working with folks who have more severe mental health symptoms and PTSD.
Okay.
So
got it.
With that, where I work, people are in PHP, which means they're there Monday through Friday from 9:30 a.m. to 3:30 p.m. And IOP, where people are there from 9:30 a.m. to 12:30.
Okay.
And they'll be there for a couple of months. So PHP maybe 45 days to 2 months. IOP can be anywhere from 3 months to 6 months. It really depends.
And then just for me, because I don't know any of those acronyms you just said.
Yeah.
What is PHP? What is IOP?
PHP is partial hospitalization.
Okay.
And IOP is intensive outpatient.
Okay.
For the most part, when I'm seeing patients, they've usually just done about a month in residential treatment.
Okay.
So sometimes people will go to rehab.
Sure.
Sometimes they'll go to other kind of residential programs where they'll spend about a month there getting stabilized, and then they'll come to us.
Okay. Got it. Okay. And then are you on a much less stressful and easier way, one of the things that I have to do as podcast host is kind of like straddle the line of, do I let the guest keep talking? Do I redirect the conversation? Like, as a therapist, how do you kind of like ride that line of like, well, they're going off a tangent, but maybe it's going to be beneficial, maybe it's not, or maybe they're going off on a tangent because it's a touch point that they didn't want to talk about, so we need to get back to the thing that they didn't want to talk about.
That's such a hard thing to answer, and I feel like it gets sometimes challenging with talking about therapy, because in my personal and professional opinion, it's all about attunement, and you have to feel it in the moment. Gotcha. It's one of those things where as you get more experience, you get better at it.
Okay.
And it also looks different, like if I'm doing individual therapy versus if I'm doing group therapy.
Okay.
If I'm doing group therapy, I have to be mindful of 12 people in the room.
Yeah, everyone's time. Sure.
Yeah, exactly. Versus individual, where it's like this could go somewhere, or maybe I need to redirect it, but I have a bit more time to play with it.
Yeah, I think also, I mean, correct me if I'm wrong, because I'm wrong a lot on this. But if you bring up a topic and my immediate response is to start talking about something else, that may be like a signal of like, oh, maybe we hit something there that they don't want to talk about. And, maybe it's not the right time to talk about it. Maybe it is the right time to talk about it. So, okay, interesting.
So the word that we typically use is clinical judgment.
Sure.
Which is, that's kind of on you.
Yeah. That's why you're the therapist.
Yeah, where it's like you
okay.
like you don't know there. And I also really firmly believe in therapy should be and needs to be individualized.
Yeah.
And I need to be with the person who's in front of me. I can't say like after 5 minutes, I need to cut every single person off. That might not necessarily be true. And, let's say I do cut someone off and that doesn't land well. We can talk about it.
Oh.
I know people forget about that.
That's true.
And we can always.
Like, oh, interesting. Why does that bother you so much?
Yeah, yeah. You can tell me that hurt your feelings.
Okay.
Like we can always talk about it. I'd rather you tell me about it.
Sure.
Absolutely.
Interesting. Okay. And then the last question I have in this kind of section here is, I can only speak for myself with my memory, but my memory is fairly awful. I like to say that my memory is more, some people say or think of memory as like a movie where it's like, oh, it's, fast forward, rewind, that's what happened. My memory is more like a TV series with episodes missing, where I just go, I don't even know what happened in that time frame. How like detrimental would that be to me in therapy, where if you're like asking me things and I just go, I have no idea, I don't remember, I don't know, like, is there workarounds for that? Is there some kind of like, or at least you could tell the person, hey, come in and let's figure it out anyways, or something like that? I don't know.
Clinical judgment.
Fair.
It really just depends, and I feel like it's important to be sensitive. And once again, as the therapist in the room, there's already like a power imbalance.
Gotcha.
There just is. And I don't want to lead the witness, or I don't want to take you somewhere that we don't know where it's going, or,
sure.
There still needs to be a bit of a container.
Okay.
For me, it's important to work with what's in the room. If you're having trouble with your memory.
Yeah.
Okay. What's that like? What does that mean? How does that impact you?
Gotcha. I almost started going into it. I was like, oh, we were in therapy session for a second. I was like, whoa, wait, hold on.
Finally someone asked.
I have to redirect. Wait, hold on. I got to redirect myself here. Time out. This is not Brandon's therapy. Okay. That's clearly hit something where I was like, oh, interesting. Okay. How does someone become a therapist? Is it, I'm going to go with the assumption of there's some school. I have no idea if there's like a medical degree. I don't know. And then what, like licensing, I'm assuming, but again, I have no idea. So kind of, if you could for us, explain the path of like how you became a therapist.
Yeah, for sure. So I got my bachelor's degree in psychology. I got a BA from the University of Portland.
Okay.
And then from there, I got a master's degree in applied clinical psychology with an emphasis in marriage and family therapy from Pepperdine University. And I'm currently in a postmaster's doctoral program, which is, I know, it's a lot of school. It's a lot of school.
Forget the postmaster's doctoral, that's a lot of syllables.
Yeah. Okay. So I'm getting my doctorate in applied clinical psychology. So with that, getting my doctorate allows me to be able to do more assessments.
Okay.
So with my master's degree, I can do talk therapy, which is what I love. I really do love talk therapy. And I just wanted to also have that skill set of being able to do assessments if that's where I want to go, like if I have a private practice later on, or just having that skill case just in case.
Sure.
But with a master's level, there's assessments that you aren't able to do without a doctorate.
Okay.
There aren't really assessments at a doctorate level you can't do.
Sure.
Right? Like as long as you get the training, but you need to have the doctorate.
Gotcha. Okay. So then within that schooling that you kind of just listed out there, where does like getting a job as a therapist slide in? Like, is it after the bachelor's degree? Is it after the Pepperdine? Is it after, is it, where does like going and getting that job kind of fit?
So when you're in your program, and every program is designed a bit differently. So for me, when I was in my master's program, my last year of my program, you have something that's called a practicum, which is essentially an unpaid internship. Most internships are unpaid. Yeah. So I did a year of that internship at a residential substance use rehab, dual diagnosis. And dual diagnosis just means substance use disorder on top of like something mood. Else.
Sure.
Mm-hmm. So I did that for a year. And then after that, I got a job at that rehab and started my doctorate. And then I had to do another practicum in my doctorate.
Oh, wow.
So I had a job running an intensive outpatient program at the rehab. And then I was also a practicum student at a crisis center.
Nope. I thought I wanted to be a therapist. I might be changing my mind right now. Okay.
We can talk more.
Okay.
This isn't.
Yeah, don't shy me away.
Yeah, I was going to say. Yeah, I'm not trying to scare you, but gotcha. I am trying to give you informed consent.
That's perfect. I think realistic is what I'm looking for. Like people go, oh yeah, it's not that tough, and then break it down. And it's like, wait a second, time out. This seems real tough.
Right. It is hard, and the unpaid part too, like figuring out, like I've had colleagues who they saved up for a year so that way they didn't have to work more on top of that year. Yeah. Are they in a position where they can be part-time? Are you married? Are you getting supported by your spouse? Because it's a lot of things to think about. Like for me personally, I was living with my parents all throughout that because I didn't want to work 80 hours a week on top of being a therapist in 2 different settings and a full-time student.
Yeah, no,
it's hard. So there's certain sacrifices that need to be made, and on top of that, with those sacrifices, I think it also then once again speaks to the privilege that comes into the room and who gets to be therapists and how that needs to be reevaluated too.
Interesting.
Not everybody can live at home.
Correct.
Not everybody does have a spouse that can support them or
have access to certain whatevers.
Yeah. Or, can afford to not get paid.
Sure.
So
got it. Interesting.
Yeah. So I think that's something like as we move forward in the field, thinking about that too.
Yeah. That's tough because there has to be also some give and take of like, okay, we want to make it accessible for people, but then it's also like, well, it's not, it's not the easiest job in the world or the, you are dealing with other humans. So, well, yes, we want to make it accessible. We also don't want to make it, just where anybody can walk in and be like, hey, I'm here. Like, tell me your problems,
Yeah.
So, okay, there has to be some balance of like how much work there has to be, but also like how to make that accessible for more people. Interesting.
Yeah. And I think about it too, like, I don't know if the accessibility necessarily diminishes the quality, right?
Sure.
Because I also think about too, like, there's a lot of folks who would make great therapists and they might not be able to not, get paid.
Yeah.
That might not be an option for them.
For sure.
Or a lot of people wait later in life when, their kids are grown up. They maybe are a bit more established in their first career and go back for a second career.
Yeah.
But, keeping that in mind too of, there is a lot of folks that look like me in this field.
Okay. Got it. What does your average day look like? So I always like to kind of put the caveat, hey, there's going to be busy days, there's going to be less busy days, but just kind of like the average typical work day, like what time I don't even know. Do you work from home? Do you do this telehealth? Do you do this in person? Do you have to go to an office? What kind of what does just your average day look like?
Yeah, so I work in a clinic.
Okay.
So my company rents a suite that has several offices in it where we do group therapy and where we also have our individual therapy sessions.
Got it.
And a typical day for me is I'll see 4 individual patients, and that's 50 minutes each. So what's called a clinical hour. And then the rest of the day I spend writing notes,
Okay.
talking to insurance companies,
That's gotta be
treatment
fun.
plans, finishing up any other paperwork, and sometimes like making calls for maybe more case management related stuff or getting the support system involved. And then what's cool about the clinic that I work at too is I actually see my caseload, people on my caseload, twice a week instead of once a week.
Okay. Interesting.
Mm-hmm.
Do you find, I mean, I'm assuming you find that more beneficial, right? Seeing a couple more, you know, the more interaction you get with somebody, I'm assuming.
It's really, really cool. I really like it because I feel like I'm able to build our therapeutic relationship and our therapeutic alliance maybe a bit quicker as opposed to once a week.
Yeah.
But I'm also in a clinic setting too, where once again, like they're there Monday through Friday. I'm also there Monday through Friday. Like we are in proximity of each other and seeing each other a lot, as opposed to when you're in private practice and you see that person for 1 hour.
Yeah.
And then it's like, I'll see you next week.
Got it.
You know, so it's a different kind of setting and interaction.
Yeah. I don't know. I feel like if you're seeing people multiple times, you know, you can kind of like set a block and then build on that block. And not that you can't do it, you know, weekly, but if you're doing it multiple times a week, it's just double the amount of blocks you're building. So, okay. Interesting.
And then I run a group in the week too. So then I get to kind of see everybody in the milieu. I get to see the people on my caseload. I get to see the people on the other clinician's caseload. Yeah. See how people are interacting with each other. And then I think they also just see more of me too. And they're just getting to know me as well.
Sure. Yeah. Yeah. That's something also that I think maybe people don't realize or think about. Maybe they do, is the like, while yes, the therapist has to, you know, is quote unquote, you know, fixing me, but maybe not.
I wish I could fix people. Actually, I don't know if I do. I take that back.
Too. But there also has to be that comfortability with the therapist. If I'm the patient, like I, you know, if I'm seeing you and I maybe only see you once a week, and once a week I feel like I don't know, you know, then I don't get the opportunity to really build that, you know, relationship as much as if it's multiple times. What time are you like typically on your way back home from work? Like when do you know, because a lot of times it's like, what time are you finished? And people are like, well, I clock out at 5, but then I don't leave until 6 because I'm doing other things.
Unless there's an emergency, I have really good work boundaries where it's like, I'm out.
Perfect.
You know, like I've done what was asked of me. I've done what was needed. Nice. And if I didn't finish it, it can be done tomorrow. But I feel like those work boundaries are crucial and essential. And I feel like my company has done a really good job too of saying like, hey, like it will get done. Yeah. You know, I've worked some places where you can't leave until all of the paperwork is done. And that can be challenging. Yeah. And that can be challenging. And that also depends on funding and billing as well. So that also has to kind of deal with the insurance companies that you're working with too.
That's funny how layered things can be, where some people would just be like, well, why don't you just leave? And it's like, well, because it's not me and it's not even my boss. It's this third party now that is, you know, put all this other things into motion. So interesting of my next question was going to be what's work-life balance for you, but you kind of got that one knocked out. So once you're off, unless there's a pressing emergency, nobody's hitting you up, bothering you or texting you or emailing you or anything like that. Nice. Okay. As a therapist, what is I don't want to, you know, try and pin you down here and be like, how much do you make? But what is the range that a therapist can make? Like, I don't know. I mean, I'd like to have an idea so I can go, is it like this? I don't even know. I don't even know what number to throw out as a maybe example.
I will say, so what's important to think about too is, are you licensed or are you an associate?
Oh, okay.
So when you're an associate, you're working under other people's license.
Okay.
So you typically make maybe, like for a clinic, what I've heard people say is once you get licensed, you get a $5 raise if you stay with that clinic.
Got it.
So that's something to think about too, like as a means of like getting your hours and, you know, making sure that all gets done. That also changes sometimes too if you're in private practice.
Sure.
So I know some folks who they maybe charge $200 an hour, but they have to pay a supervisor, and the supervisor maybe gets like 30, 40, 50% of what that clinician makes.
Hours, yeah.
Right, because you're working under their license.
Got it. Okay.
So you have to operate under someone else's license and regularly consult and get supervision and case consultation to make sure you're being ethical and doing all the right things, right?
Okay. Makes sense.
And then once you get licensed, you can typically make more money. The flip side of it too is if you're doing therapy, talk therapy, or if you're doing more of those assessments like I was talking about. So with assessments, those tend to be a bit more lucrative in nature.
Sure. Okay. Yeah. Well, also, you've spent the time and gone and got all the education. Mm-hmm. I would hope that in turn that kind of gets you somewhere.
Yeah. and it truly does. Okay. Once again, depend. Nice. Like the clinic that I'm at, I make maybe like 12% more than what unlicensed clinicians typically make.
And another caveat I always like to throw out there is I'm sure it depends on size of your company. I'm sure it depends on location in the United States. I'm sure it depends on a lot of factors. But okay, interesting. All right. So the next thought on that is, what is the employment opportunity? So when you finish, is there just jobs waiting for you? Is it a really tough job market, or are therapists in need right now?
Therapists are definitely in need.
Okay.
So what I was taught in school and what I'm noticing is working for me is I've worked in clinic settings, and that's been really beneficial for me in a sense of making sure I get my hours so I can get licensed.
Gotcha.
Okay. So there are some folks who maybe they graduate and they go into a group practice, or they go directly into private practice.
Gotcha.
If your patient doesn't come in for their session, you get
nada.
Well, it depends on your cancellation policy.
Okay. Sure.
But that's an hour that you don't get towards licensure.
Okay. So maybe you do get paid, but regardless, you're not getting that time.
You're exactly.
Okay.
So working in a clinic setting, I work for sure 40 hours a week, and between
you get your hours,
the patients, the consultation, the writing notes, everything that I'm doing, I'm getting those 40 hours, and I'm able to rack them up pretty quickly. So it's a bit easier for me to get towards licensure.
Interesting. Okay.
But in the flip side of that too is I am not necessarily in a headspace or maybe ready to start my own business. I don't know if a lot of people think about when you start a private practice, that's a business.
Yeah.
You are the business. Yeah. You have to get your lawyers. You need to get your note system. You are doing
payroll, benefits for employees. Yeah. All that stuff. Yeah. Insurance.
You're doing all of that. Yeah. That's all on you.
Yeah, that's a lot.
And coming right out of school. I mean, if you are, a business person, that sounds great.
Sure.
I wasn't ready for that.
That's also interesting too, though. It's if you're a business person, but it's but I went to school for psychology. I'm going for psychology. I'm going this route. I'm not going the business route. So it's almost you'd have to have either a business minor or somebody that's the business savvy person or something like that if you're trying to open your own. Okay, interesting. I was also going to be somewhere along the lines of the next thing I was going to ask if that was a desire of yours or not. Okay. That's about it that I have for you for the podcasting side. The last little bit of the podcast I always like to leave for my guests to talk about either a personal cause that's close to them, a small business they want to talk about, something they want to promote, whatever they want to talk about. Here's your time.
There's a really great emergency clothing donation called Shariah's Closet here in San Diego. It's on El Cajon Boulevard. I can say firsthand, I've seen folks who get that emergency clothing and it makes a big difference.
All right.
So instead of maybe going to one of those big drop-off places, if you can go to a local emergency clothing donation, or if you can go to Shariah's Closet, they do really great work.
Do they take all clothes, male, female, children, everything?
Yep. Okay. Yep. As long as it's just not stained and has holes in it, quality clothes,
sure.
it makes a difference.
I'm going to make a call out to any guys out there that have clothes. I know from friends and personal experience that guys' clothes are typically in need at places like this because a lot of it's just not where the donations go. So, fellas, if you're out there and you have your extra clothes, Shri's Closet.
And are you familiar with 988?
I'm not.
So 988 is the mental health equivalency of 911. Nice. So if people are experiencing a mental health crisis, they can call 988 and they can get services.
Awesome.
Or they can get help.
Any kind of mental health service, anything? All right.
Yep.
Nice.
Yeah. If you are experiencing a mental health crisis, there's someone on the line and you can call 988. Awesome.
988. Okay. Well, thank you for being with us. Thank you for sharing your time with us. I really appreciate it.
Thanks for having me.
Well, that's it for another episode of the Jobology podcast. Thank you for tuning in. If you guys want to support our channel, please make sure you like, subscribe, and follow at Jobology Podcast on all major social media platforms. Your support means everything. Like we say to end every episode, make good choices.